afternoon and welcome to the making of the Cape Verdean. I'm here today. I have my co-host, Justina Perry. Welcome, Justina. And we have with us today Dr. Julio Teixeira and Dr. Patricia Andrade. And we are expecting Dr. Rui Fernandes to join us as well. So I want to start off with giving a brief bio on each of you. And then we'll proceed with some of the questions that we have on this exciting program. And again, I'm so glad to have you join us today. So Dr. Teixeira, you're certified by the American Board of Surgery and a fellow of American College of Surgeons. And it says here, Dr. Teixeira has been newly appointed to the Carmen and Peter Bach Endowed Chairman of Surgery. Is that at Danbury Hospital? I just have to be.
Yes.
Okay, Danbury Hospital. And it says Nuvance Health and is a clinical professor of surgery at the University of Vermont. He was also assistant professor of surgery at Albert Einstein College of Medicine and director of the bariatric surgery at Montefiore Medical Center until 2005, when he joined the faculty at St. Luke's Roosevelt Hospital Center, where he served as associate clinical professor of surgery at Columbia University College of Physicians and Surgeons. And he's also the president of the Cape Verdean Medical Society. And then next we have Dr. Patricia Andrade, my dear friend, let me just fix this. Dr. Patricia Andrade is a board certified general surgeon with a specialty interest in breast surgery as well. She practices at Morton Hospital and St. Anne's Hospital, both in Southeastern Massachusetts. She is currently the chief of surgery at Morton Hospital, and she did her surgical training at Rhode Island Hospital, Brown University in surgery. She has practiced in medical missions to Cape Verde and is interested in helping to enhance the healthcare delivery. She has been in New Bedford, on the board of New Bedford Health for many years and continues to contribute to public health. And I'm going to give a little brief background too, as well, on Dr. Fernandes. Hopefully he can join us. Dr. Fernandes is a professor of surgery at the University of Florida College of Medicine, Jacksonville, and holds appointments in the Department of Oral and Maxillofacial Surgery, Neurosurgery, Orthopedic Surgery, and the Division of Surgical Oncology. He serves as the Chief of Head and Neck Surgery and the Director of Head and Neck Surgery, Microvascular Reconstructive Surgery Fellowship, Director of the Center of Reconstruction Surgery, and co-director of the Skull-Based Surgery Program and associate chairman of the Department of Oral and Maxillofacial Surgery. I hope I'm saying that right. All these terminologies is kind of like, and also just to give you, I want to give you a little background on Justina as well. Justina is a doctor of physical therapy who specializes in pelvic health and a lifelong New Bedford resident. Justina is also the founder, which I'm so proud of her, of the program, as director of Buy Black New Bedford. It's a free community resource based in New Bedford that serves Black-owned businesses across the whole South Coast of Mass. So welcome, everybody.
Thank you.
Thank you.
I also want to mention, there was a young lady who I think, Tricia, you probably know, and Justina, you might know her well. I love this name, Dr. Maya Angelou Spencer. She was going to come on today and observe with us. And she's a graduate of Howard Medical School. She's completing her residency at Brown University at the residency program at Hasbro Children's Hospital. She will be practicing pediatrics and arduous health in Braintree. So she was, you know how when you were in these programs and you're interning, so she's busy and she cannot take the time away to join us today, but I just wanted to mention that she was going to be a part of the program.
Okay.
So moving on, I wanted to have both of you, and when Dr. Fernandes comes on, I want you to talk about first briefly who your parents are, and what island they came from, and your grandparents. I do this in every show. So we're gonna start off with you, Dr. Teixeira. Who your parents are, what islands they come from, are they still there? And just briefly give us that information.
Okay, so my father is originally from the island of Santo Antão in the north.
And his name?
His name is Julio Teixeira, like me, yeah.
Okay.
And he comes from a long family tradition there in the islands. He immigrated, his family immigrated to the New Bedford community and Massachusetts communities in the early 1900s. But we only came in the 1970s. My mother's family is from the island of Santiago, Barella family, and they married when my dad came to Santiago as an elementary school teacher. And we then immigrated to the United States in the 1970s. My dad was a teacher there. He worked a little bit as a teacher in the Cape Verdean Portuguese community in Providence as well for a short period of time.
Okay, well,
they both returned back to Cabo Verde after I graduated from medical school. My father recently passed away a couple of years ago.
Sorry to hear that. But I found that many folks that come here and accomplish what they want to, and then they want to go back home, as they say, go back home. So I understand it. And Dr. Patricia Andrade, who are your parents, grandparents, and what islands?
So my mother is Isabel Andrade, my father Armando, and her name was Rocha actually. And my father was Armando Andrade. Both were born in New Bedford. My father was born in the West End. My mother was born in the South End of New Bedford. So I'm a native New Bedford person as well, was born in New Bedford as well, along with my 4 siblings. My grandparents, my mother's family, my mother's parents are both from Boa Vista, the island of Boa Vista. And they immigrated to the United States in the early 1900s, just before the Depression time. Initially, they went to the Cape, but they decided to settle in New Bedford, and they bought a home across from the famous Monty Park, and made had children and great grandchildren, and lived there almost and pretty much until they passed away. And then my father's family, my father's father is from, they're both from Sunny Cloud, the island of Sunny Cloud. And his name was Jose Andrade, and he was a whaler. He came to New Bedford through the whaling industry, and he actually had purchased a whaling boat at one point in time. And then when he retired from whaling, he became a caretaker over at Buttonwood Park. And my grandmother was Anna Lopes de Silva, and Anna Lopes. And she also is from Sunny Cloud. She was a homemaker, and they both had, I think 6 children altogether, and settled in the West End. So I'm a 2nd generation Cape Verdean American, and very dedicated to that.
And I'll just say this briefly, that house that you talk about across from the park, I sat on those steps as a teenager for many years.
Yeah.
And they were so good to us. They let us just sit there and sing. And we're talking about like I don't want to date myself, but we're talking like in the 70s, 60s, 70s, whatever.
We couldn't, as kids, we couldn't wait till we were old enough to sit on the wall, because we were forbidden to sit on the wall. It was the place to be, with
it was,
especially in the summer. They'd have music and basketball, and people were out all hours of the night, but we were forbidden to cross the street even.
And we had so many little singing groups and everything, but we'll talk more about that later.
Jeanne and Dr. Andrade, did you both grow up together? Did you go to schools together?
Wait, Rui's coming in. Can I, okay.
No,
Harry.
my father was in the army, so we moved around a lot.
Mhm.
We actually moved, we lived in multiple places. And so I went to kindergarten in New Bedford, then third grade, and then came back for eighth grade through high school. So I didn't spend a lot of time growing up in New Bedford.
I understand.
Okay,
Mhm.
let me introduce Dr. Rui Fernandes. Thank you for joining us. And what we'd like you to do, because you just came in on time, we'd like you to, I just did a little background on you. I did a little brief bio on you, but I'd like to ask you to tell us where your family, who is your parents and grandparents, and what islands do they come from?
Okay. Yes, my mom.
welcome.
Oh, thank you very much, and apologies for connecting late. I thought it was 7 o'clock Istanbul time. So my apologies. Yeah, so my mom is Elisa Andrade, and she comes from Praia, and she married my father, who was Adolfo Fernandes, and he was born in Brava and moved with his family to Praia for many years. He used to be a nurse at Agostinho Neto for many years, and then prior to us emigrating to the States. So that's my background, more or less.
Okay, so thank you for that. And again, thank you for enjoying. And believe me, I understand you're in Istanbul. You're in night, and we're here right now very early, not that early in the morning, but I really appreciate you coming on.
No problem.
So we are going to, one of the things I want to do is, I think Justina, I think you have the next question here.
Sure.
Yeah,
I can take it away if you'd like.
yes.
Okay, so my first question is to Dr. Teixeira, because I understand that you serve in the role of president of the Cabo Verde American Medical Society. So I was wondering if you could tell us and the audience a little bit more about the society.
Thank you for the opportunity. It's a pleasure to be here. Our society started approximately about 2 years ago, around this time. The pandemic was just raging on in New York.
Right.
Everything was paralyzed, and even my clinical activity is somewhat limited as a surgeon. And so the focus primarily doing some acute care surgery. And so I had a little bit of time where I started to say, how can I help? How can I help back in the islands? What can I do to help? And I started to think about, well, I know some of the doctors around. I know we had, 20 years ago, a few of us had come together and started talking about doing something. So I started making some phone calls. I started looking for colleagues of Cape Verdean ascendancy, and slowly I started finding more and more people, and we started meeting on a monthly basis and talking about the pandemic and ways in which we could contribute. And slowly we developed enough of a critical mass to begin to form an organization. And this is how our society came together by the early days of the pandemic.
Well, thank you for sharing that history. And I can relate a little bit to being laid off. We were on furlough in the pandemic and feeling like, how can I give back? So I think that you all use that time very wisely and organized for a really important mission. So over the past couple of years, it's been a short amount of time, but how many members do you have in the society, and what are the specialties that you all bring to the group?
We've been growing organically and slowly, and the more you met people, the more you knew that someone knew another person. And the very interesting thing is we found a lot of doctors in clusters, family clusters. We found families that had this deep rooted in need and interest and focus on education. And so within a family, you'd find 2 or 3 doctors, which is kind of really fascinating, the idea. And so as of now, we have almost 75 doctors in the group. We also have some other healthcare providers, such as advanced practice nurses. We have mental health professionals as part of the group. And we certainly would like to invite you as a doctor of physical therapy to be part of our group
I'd
as
be
well.
honored.
So That is a very multidisciplinary program that we have. The group includes all multiple specialists. We have cardiologists, we have pediatricians, we have a variety of different surgeons, everything from plastic surgery to head and neck surgery, and orthopedic surgeons. We have primary care physicians, a variety of specialties, including mental health. And so as we made our initial trip to Cabo Verde this year, we actually brought a team of 26 doctors with multiple specialties.
We're going to get to that. And I just want to ask you, where are these folks located, all of these members?
So, the interesting thing is that Zoom was really is what brought us together. The technology during the pandemic allowed us to take advantage of it to really bring us together. And we have members all over the United States. We have Rui in Florida, I'm in New York, Patricia in Massachusetts. We have members in Texas, in California, in Wisconsin, in Chicago, in Ohio. We have members really across the United States.
That's
And
great.
was the plan always to make a trip to Cape Verde and to serve the community there, or was that kind of how the mission has evolved?
It was slowly began to develop a concept of what our mission as a society was. And we saw multiple interesting avenues for us. One was to also work towards improving the quality and delivery of healthcare in the Cape Verde Island. So a mission work would be a part of that. And having an exchange with the community of physicians there would be an important part of changing the culture of healthcare delivery, as well as bringing new technology, professional education. We also saw the component of healthcare advocacy for our community. How could we help to be advocates for healthcare for our own community? But just the mere fact that we exist as an organization, I think it's an important part of self-esteem for our community to know that we have a professional organization of highly qualified physicians who can be role models to our community, and also to provide not just a role model, but also scholarships, opportunities for research and mentoring for the youth in our communities.
Well, we need to bring Dr. Andrade in on that and ask Dr. Andrade. I think you had that next question too, Justina, as far as what was the mission, purpose of the
Well,
mission.
thank you, Dr. Teixeira, for sharing about that initiative. And can you also just let people know where they can learn a little bit more about that website, so that they can discover all that you've built over the past couple of years?
So yeah, our website is CVA Physicians. It's Cabo Verdean American Physicians, cvaphysicians.org. And again, it's you have an opportunity to learn about the different activities that we're doing. We have the opportunity to also donate to our cause through that website. And you can also join our community through that website.
Very
So,
important.
yeah, we need to
cause.
be, yeah, we're kind of jumping ahead with some of the questions, but that's fine because I wanted to get to Dr. Andrade as well. I know that you recently visited Cape Verde, and what was the actual purpose of that that new mission that you just went on recently? I think it was April 1st. Is that when it was? April 1st?
Yeah, yes, we went, technically it was about a 5 to 6 day trip. And the purpose was really to begin some kind of collaboration with the healthcare providers in the Cape Verde Islands. As Dr. Teixeira has just explained, we've been having a series of Zoom meetings over the last 2 years. And during those meetings, we would invite physicians and healthcare providers from Cape Verde to do presentations to our group to help us to learn and understand the status of healthcare, what their capabilities are, what their needs are. And so the trip was organized as a cultural educational exchange. It was because it was our first trip for this particular group. The most important thing we wanted to achieve was to learn about the healthcare delivery system, to learn about what they have available, what they don't have available. How can we as American physicians, Cape Verdean American physicians, offer help and support to the Cape Verdean physicians that are actually practicing in the country.
And Dr. Rui Fernandes, thank you again for joining us. The question we have for you is that I know the mission was to promote and support advanced medical treatment and to do research and educational and cultural programs. While you were there, did the group meet other physicians to discuss the advanced medical treatments? And, it was this part of, as I know, Dr. Andrade and Dr. Teixeira said, but who did you meet when you were there? I mean, was it physicians with specialties in certain areas of surgery, or was it all involved different physicians in terms of the different specialties?
Well, I think it was, for me, I think it was a two-pronged benefit. One, as both Dr. Andrade and Teixeira mentioned, is it was truly an exchange. And that exchange was not only between common specialty. For example, I operated with colleagues from ear, nose, and throat, maxillofacial, but also general surgery. So that exchange was excellent, so that I learned from them and hopefully vice versa. But I thought the other excellent benefit of this was that I learned and I became better friends with Julio and Patricia and all the other members of the community that went together. And I think that helped to strengthen our bonds. So to me, that was a really a great benefit.
The Cape Verdean network is great. It is. I mean, especially when we're surprised at how many people we find that are in the same field or have the same interests. So yes, that's definitely. I'm so proud of you. First of all, I want to say all of you. I'm just so happy. Tricia and I have gone on a trip to Cape Verde when we were doing another project, and her with Vanessa Brito at one time. And I know there's a lot of other members who are part of this group that are on your board. So does somebody want to talk about that, who some of the other board members are? Mention, I know that you have a treasurer and a secretary. Isn't Vanessa Brito on one of those?
Our board consists of also Dr. Nibel Mello, who is a nephrologist, a kidney specialist out in St. Louis, Missouri. It also includes Dr. Susan Weinberg, who is a radiologist out of Florida, who is our secretary. And our treasurer is Dr. Patricia Alves, who is an internal medicine specialist out in San Antonio, Texas. So we have, that's in addition to that, we have other members of the board, which include Dr. Vanessa Brito and a few others who are also ad hoc members. Dr. Tatiana Souza, who's a dermatologist out in Austin, Texas. And we have also Samantha Andrade, who is also a urogynecologist out in Los Angeles. So they're all members of our board.
Okay, I'm going to let Justina pop in here, but I'm going to ask one more question about Dr. Andrade or Dr. Fernandes. You can answer. What was the most challenging surgery that you performed while you were there?
I'll default to Patricia.
Oh, you're going to default to me? I thought. Honestly, I don't think the surgeries were that challenging because we've all, much as I hate to say it, we're all kind of older and have a lot of experience. So they weren't challenging in the sense of technical challenging. What was more challenging was trying to do a very rapid assessment of the patients that they presented to us. Because what they did was they did a very good job of picking cases that were quite difficult and quite challenging for us to evaluate. And I think that was probably the most significant challenge of everything, is to try and do a very rapid assessment of these patients in a matter of just a few hours to determine, not technically can we do the operation, but is the person fit enough to withstand the kind of operation that they need, and do they have enough support to support this patient in the postoperative time frame. So that was, I think, the most challenging part of this mission overall. And I think that was one of the things, I know that was one of the things that in our debriefing meeting that we did talk about how to screen a lot of patients and work them up before we all arrive to make it so much more value, our time valuable, and what we can offer a much more valuable experience. Because, if you're there, we can do any kind of surgery for 2 hours, but that's not what's important. What's important is how can these patients recover and who's going to take care of them. And so as surgeons, that's the most important thing that we think about in terms of what we do, because technically we can do almost anything, but it's that aftercare and that is really makes or breaks success. And so
I think, Justina, that falls into the question that you had, Justina.
Yeah, talking about those challenges, Dr. Andrade, can you talk about any specific cultural differences or barriers that are unique to this population that you found as compared to patients in the US? Can you tell us more about those barriers that you are finding in follow-up care and some of the social supports that they may have?
Yeah, so that's a very good question, because one of the barriers, one of the challenges is that preventative care and screening is not something that has been actively done at a very high level for a long time. The physicians in Cape Verde are realizing and understanding the importance of screening and preventative care, and are really doing multiple initiatives to try and get that to become a norm and mainstay. But the population has not been accustomed to preventative care and their access. There's significant impediments in terms of access for routine care and preventative care. And then there are the economic impediments with the healthcare system in general. So there are definitely different levels of challenge. And it's not that people don't want to think about their healthcare or address it, but it's not something that it's not normally done, because access becomes a real problem as well.
Right.
Maybe
if I can
Dr.
add
Fernandes.
something to that,
Yes.
I think another aspect that was quite fascinating, I think Rui pointed it out, and he can expand more, is the fact that patients in Cabo Verde have a difficult time asking questions. So we had a lot of patients who are afraid to ask their questions about the types of surgery. And some of the operations were so complex and had associated risks that the patients were often afraid to ask about those risks. And so one of the things we would approach patients, do you have any questions? They were like, no, we have no questions, but you should be asking about this nerve that potentially is gonna get injured during this operation. Brie, I'll let you expand more if you could.
Sure.
Let me just interject on that, because even here in the United States, though, folks that, don't feel comfortable asking their doctor questions, sometimes you have to pull it out of them and, and have a way to get them to open up. But go ahead, Dr. Fernandes.
No, I think certainly one of the things that it was endearing to me is the amount of trust that the patients put on the surgeons and all the other physicians. So that was nice to see. At the same time, the other side of the coin is that I think it ties into what Patricia was mentioning, is sort of that cultural as well as education, to know what are the appropriate questions to ask. And then I think there's a certain degree of potentially not offending the doctors by asking questions. I'm not quite sure exactly what all the factors that lead to that, but I think those types of things can easily be overcome by educating the patients and by letting them know it's normal to ask those types of questions, and that's what we're there, and that's the essence of an informed consent. I think the other thing that I found challenging, to go back to your questions, to your previous question, is that, and is the issue of resources and timing. One of the challenges that I personally found was patients would show up with, let's say, imaging before, because they had a tumor or what have you. They obtain a CT scan and so on. But those things may be aged, a few months old. And I think that notion that those types of things need to be updated because things can change by the time you get your time for intervention, like when we arrived. And the timing to, let's say, if the patients were willing to get another one, how quickly that could be done, and those types of things. I think that, to me, was a bit of a challenge. But again, it's one of those things that I think can be overcome. And just for me, that was my first time operating back home. So it was a learning experience.
There's always
And,
more to learn, right?
Right. And I just want to say this, especially, I mean, we go through this here in this country. Often when we walk into a doctor's office, and, during my time as a child or as a young adult, all the doctors were white. And nothing against them. I know we have some great doctors out there, but people always feel more comfortable when it's somebody that looks like them. And
Or
I know,
speaks their
especially,
language.
or speaks their language. Exactly. Exactly. So I know that, I don't know how many doctors are in Cape Verde that are Cape Verdean. Can you give an idea of that? Do you know? I mean, kind of.
I think most of the doctors,
Yeah,
I think most of the doctors in Cabo Verde are Cape Verdean. There are some foreign doctors, most of them are, but the interesting thing is that over the last 10 years, we've had actually a decrease in the number of doctors practicing. And that is actually quite fascinating, because I thought we would see the opposite, we would see actually an increase in the number of doctors. We would see actually a decrease. The interesting about us going there, and although they see a lot of medical missions from other countries, they go there. This is different. This is we have a level of authenticity that we bring with us by being Cape Verdean and speaking the language. It's a completely different experience than a foreign team arriving there.
Mm-hmm.
And I also, if I could add, I think, and this was noted by all of the members of the team, was that we approached this embracing our colleagues in the islands, as opposed to simply coming in to do something and leaving. And I think that was rapidly noticed by our members in the Cape Verde Islands, and they in turn embraced us. And I thought it was really a great exchange.
I know I've been on other medical trips to Cape Verde. This was a quite unique, a very beautifully unique experience for me personally, because there's something inherently spiritual almost of the Cape Verdean people and Cape Verdean people descent, and there's an automatic sort of camaraderie and love, and that was felt immediately. We were all essentially strangers outside of Zoom meetings before we landed it on the airplane, literally on the airplane going to Cape Verde. And by the second day, we were as if we've known each other for 20 years and 30 years. And the same thing happened with the physicians in Cape Verde, and all the physicians that I have met in Cape Verde who are working in Cape Verde are Cape Verdean. And there was this immediate bond, because we were Cape Verdean and we were there for them and with them, and it just created a whole different level of work and a whole different level of camaraderie than I had ever experienced ever before. For the first time I was in an operating room when I operated with Rui. every single surgeon was Cape Verdean. The anesthesiologist was Cape Verdean. The nurse anesthetist was
Beautiful.
Cape Verdean. The scrub techs and the circulating people were all Cape Verdean. And I had never in my life had such a wonderful, it was just a wonderful experience. And I think because there's that blood relation we all have, we can actually achieve a whole lot more than other groups who have come in before.
And you're all part of the same culture and you understand. I mean, I think that's phenomenal. And Justine, I know you can jump in. I just want to ask this quick question too. Did you, Tricia, Dr. Andrade, I know that your specialty is breast surgery.
Yeah.
Did you perform any breast surgery while you were there?
No, I did not. But Dr. Susan Weinberg, she's a radiologist, is a breast specialist. She and I actually, some equipment was donated to her that we brought with us to teach the pathologists how to do a better core biopsy. So we did some instruction on how to actually obtain better tissue from a breast biopsy so that there could be a much more accurate diagnosis. So we didn't do any, I think they did actually do one patient, I think, but we did teaching for the pathologist, who's the one who actually is doing a lot of the biopsies, and one of the radiologists on how to do these core needle biopsies with the equipment that was donated, that we brought a few of these devices with us.
Amazing. And I know, Dr. Fernandes, you have an extensive background in neurosurgery and a number of other things that it'll take me a half hour to talk about. But can you tell me, did you perform any of the surgeries in your specialty area?
Yeah, we had the opportunity to do some thyroids and parotid tumors and so a variety of tumors. So it was nice. And again, it was all done in collaboration with colleagues from there.
And Dr. Teixeira, you?
Yeah, I had a great time in terms of the surgical experience. We brought about $500,000 worth of equipment and materials that were donated by a variety of different companies. And part of the program was also a teaching component to where we were trying to teach how to do minimally invasive hernia surgery. And for instance, we did a number of operations, both Patricia, Rui, and I, and some of the gynecologists that joined us as well. Then patients that otherwise were waiting to be transferred to Portugal to undergo surgery there in the future in an undetermined time. And we were able to solve some of those problems right there. And I ended up having to do, for instance, a thoracic operation, someone with a tumor inside of the chest cavity that we removed, and that patient otherwise would have waited months and months, if not years, before she got transferred to Portugal. So from a surgical standpoint, it's very gratifying in many ways, and only the transfer of information and the teaching, but also some of the problems that were solved, not only me, but all our colleagues, including some of the gynecologists as well, who are part of the team.
Justina, go
hear
ahead.
the love and the passion that you all have
Mhm.
for what you do when you speak about the experience that you had. So thank you for sharing that. And I'm also, to Dr. Teixeira's point about the lower amount of people pursuing careers in medicine out in Cape Verde. I think that groups like this can really be inspiring in kind of creating that network and something for younger folks to look to as, okay, that's achievable. And there's a community there that would kind of support and embrace what I'm doing. I think that this can be helpful for people who may want to pursue that carear and think that it's off limits. So,
but one other thing that we did when we were in Cape Verde is a group of us went over to the medical school, because they do have a medical school now as part of University of Cape Verde. And we met with some administrators of the medical school to try and understand how that works and how can we align with them and give them support. And so we came back with a few initiatives of how we can support the students in the medical school and as they pursue their studies.
Okay, so I want to get to also that I know that you met with President, the new president was the Prime Minister when I met him a long time ago. What was that meeting all about? I mean, I'm sure he was happy to have you there, and you also met with the Prime Minister as well. So whichever one of you wanted to start.
We had delegations of people doing multiple meetings simultaneously, which was another awesome thing about this group, was that even though we had a common agenda, there were sub agendas, and we were able to achieve a lot of those sub agendas. So one of the realities of dealing with another country is you have to learn how to deal bureaucratically with the politics and with that level of government. Now, we are clearly, we've stated clearly as an organization, we don't want to be a political organization. We don't want to align with politics, but we recognize the importance of making those connections. And so because of that, we met with the Prime Minister, we met with the Minister of Health, we met with the President of the country, because we need them to understand that we are independent. We're not a non-governmental organization, NGO type thing, but we definitely want to contribute to the country. But we also recognize the importance of working within the political realm. And so that's why we had those meetings with certain levels of government, because it's a necessity in terms of getting acceptance and also being recognized. And so most of it, again, was another exchange so that we could hear from them about what they perceive their healthcare system to be, and how we can help them to get it to improving the healthcare system. And so that was most of the goal of all of these meetings, was to hear what their perception is, what they believe their status is, and for us to say, okay, well, here are the kind of things that we can intervene and how we can use our resources, whether it's intellectual resources or physical resources. In the letter that I composed to the president, because I was on the delegation, I stated that a lot of times when people talk about Cape Verde, they say, oh, there's no natural resources that get exported from Cape Verde. And so I raised the point and clarified, we are the largest exported resource from Cape Verde. These Cape Verdean descendants, us, who are first generation, second generation, are the largest exported resource of Cape Verde. And we then can contribute back to the country. And so and our organization is a huge example of that, how a group of people who are either directly born in Cape Verde or second generation, third generation, and then want to come back and contribute to the country. And so I think it's important for them to understand that. And that was one of the reasons why we had these political meetings.
And I want to also, and thank you for that, Tricia, because the point that you made, I remember a while ago when somebody said, this was at one of the museums, they said, well, what does Cape Verde have? And President Pius at the time, he said, what we have is our people. That's what we have when they talk about the resources. So, and it's true, we have our people. So Dr. Teixeira, you want to expand on that a little bit, and then we'll go to Dr. Fernandes to expand on that?
Yeah, I think that's a great point that Patricia made with regards to our natural resources. And also, we made sure to get that point across to the government from the point of view not only of what we can bring, but also the fact that very often when it comes to healthcare, they rely a lot on relationships that are pre-established, for instance, with Portugal, for instance. And so the patient has a specific issue, they always reach out to Portuguese colleagues for support and help with patients, where we have often those resources here among us. And so what the point that we brought to them is like, your first line of help should be us. We want to be a line of help. So when you need something, when it has to do with like a head and neck cancer or a breast cancer, we have specialists here, or whether it's a kidney disease problem that's difficult to manage. We have resources in the community that you can ask for help. We should be a resource for you whenever you need that advanced care. And so that's what our role is, in addition, is to be a resource to our colleagues there.
Dr. Fernandes, you wanted to add a little to that?
Well, I think my two colleagues have said it very eloquently. I think the only other thing I would say is that is also to serve as a reminder that when thinking of investing in the future, that they think about the Cape Verdeans there themselves, and then to invest upon them, the current surgeons, the current physicians there, and perhaps send them over and to spend some time with us, so that they can kind of expand a bit and then take that resource back. So I think it's a full circle. And I think one of the ones that the biggest reminder is that the greatest outcome will be by investing in ourselves.
Absolutely. So Dr. Teixeira, I know you said you had some photos that you might want to share with us. I think we got at least another 15 minutes. So if you want to share some of those photos, I would appreciate it. And I know my co-host would as well.
Okay, can you see my screen?
Yes.
Okay. Let me see if I can. So you can see here, this is where we packed our equipment to bring to Cabo Verde. And let me see if I can move this bar.
Did they charge you on the airline to transport that, the equipment?
Yeah, so
Oh,
certainly that we had to pay a lot of money because some of the equipment was very heavy to transport, and that led to certainly a costs. But the good news is that these are all the companies that donated equipment and materials, over $500,000 in equipment. The good news is that the New Hampshire Air National Guard has now established a relationship with us, and they're willing to fly our team and all our equipment to Cabo Verde for free.
That's
wonderful.
Oh, that's wonderful.
Yeah, that's a great victory now that we have achieved, and that's going to help us with the process. See, these are our colleagues. This is Patricia packing and getting things ready to go. This is us on the getting ready to fly, and on the plane, it's Vanessa Brito and Nibble and Rui and others. It's arriving with all our equipment, as you can see here.
Wow.
And again, this is our first dinners with our local colleagues, getting to meet everyone, and again, establish a relationship with everyone, getting to know a little bit of the island as well. And we really became friends. As you can see, Patricia getting close and personal with Dr. Fuentes from anesthesia. We really got to know each other really well. We would visit the hospital. So you can see a lot of structural problems. Things are like taped together in some of the operating rooms. We brought in new equipment, as you can see, and set things up and got it ready to work. And you can see some of the surgeries being done with our brand new equipment that we brought in. And see Patricia teaching in laparoscopic surgery, Dr. Fuentes helping with anesthesia. And you see here Dr. Gilles Freitas as well working. And this is our ophthalmology team that went to San Vicente. They did cataract surgery there. About 21 or 22 patients who were almost blind, who were able to start to hear some of the cataracts removed, black and brown cataracts. Yeah, this is our meeting with the president and the prime minister. Here's me and Rui doing surgery. We were really busy doing some cataract surgery, and Dr. Roberto is teaching our local colleagues how to do cataract surgery in Cabo Verde, so they can do it themselves. This is our mental health team that went and met with multiple human rights organizations and organizations that focus on sexual abuse of children and sexual violence and human trafficking. You know, we had ran into some structural problems and all kinds of help. This is some guy out in the shop who was able to fix some of our equipment and make it work. This is Rui doing some of the really aggressive surgery with like major difficult lip cancers, which are never not being removed and being reconstructed. We have some other lesions that were removed and did a fantastic job reconstructing it. Here's we had Dr. Rosilda James, who also presented a book that she wrote on sexual violence and in children, which was really well received. This is our GYN team. They did a bunch of GYN cancers, patients that were willing to be transferred to Portugal. They got really busy doing really complex GYN surgery. This is Samantha from Los Angeles and Dr. Lopez from Boston. They did an amazing job of really difficult, complex operations. This is Dr. Gilles. This is a patient with this massive keloids. You can see like triple team by Dr. Freitas, Dr. Andrade, and Rui all working together to take care of this patient. This is a patient with a thoracic tumor that I removed along with the help of the others. Again, we did a total of 51 operations, about 3 days of surgery. We met a bunch of people. We had all kinds of meetings, and so we organized a symposium. We met with students from high school and college. We met the U.S. ambassador. We were busy over this period of time. This is part of the symposium that we did with the Minister of Health, the Minister of Communities. Here's our team talking about the different experiences they had. The World Health Organization was involved. The UNESCO was involved. A truly amazing experience. So
that seems
we met high school students. Yeah, so just truly amazing experience. And we also brought simulation technology to help teach, and so they could keep this and continue to practice their skills. And follow up of our patients, created databases so they can continue to track patients on registries. And then we celebrated before we left. So
it's fun. I have to applaud you. That is so phenomenal. That's beautiful. I was so excited again to have you, all of you here today, because I said, as I invited Justina to come on as my co-host, I said, you know, this is something I have to do because I'm so proud of you all. I get emotional when I think about it, because when we think about when our grandparents or parents were there, they had none of this. And for you guys, folks, to take the time to go over there and to provide the knowledge and the resources and all of that equipment, that I have to applaud you again. Thank you, Justina. Go ahead, because I'm getting ready to cry.
I'm sure that this touched so many people's lives. And I think, you know, I was expecting to hear about the operations and the medical interventions, but there was so much more that you were able to accomplish when you were there, resource sharing and network building and teaching. That mentorship is invaluable. So I'm just really, I'm happy to hear about all of this. So thank you for sharing your stories and those pictures and bringing us along with you.
Right. And I have one other question to ask, because I went on your website. Tricia had provided the website to me. And I went on and I saw, and I'm glad you talked about this, about the trafficking and the sexual abuse, because Madeline Tully, Dr. Madeline Tully, who's part of your group, just one of you give me a little bit of information on it, because I found when I was reading what she had been doing, I just thought was fascinating.
Yeah, so Madeline is one of the most enthusiastic members of our team. She's in primary care out in Wisconsin, Milwaukee, Wisconsin. And Rosilda Jamie is another one who is in San Francisco. They both led our mental health team, and they really focus on sexual trauma and violence in children. And in Cabo Verde, this is a underreported problem that needs to be addressed.
Right.
And so our team was able to highlight some of these issues and bring in some and talk about some of the strategies and techniques, not only in terms of prevention, but how to treat people with this type of trauma. And so this was a really emotional, deep experience for our team in general, and an area that we definitely want to expand the type of teaching and training that we offer. And so it's a very exciting part of our team. So everyone wants to hear about the surgery, and the surgery is exciting, but this is an aspect as well as the other aspect, which is the screening, the cancer screening. So one of the things that we do want to do is buy a mobile mammogram machine, for instance, for breast cancer screening. So we are having a fundraiser July 9th at Cesaria Restaurant.
I was going to mention that was part of my announcement. So you're pushing ahead of me, but that's okay.
Okay.
I want you to mention that real quick, because I have one more other question on this being the time, especially here in the United States, about Roe versus Wade. Now, how is the situation with abortion in Cape Verde? What is the law there about that, or do they have access to that? Or Patricia, you want to answer that?
I have no idea. I actually don't.
Okay.
Cabo Verde is a very religiously traditional country. It has its Catholicism is a major religion, and that creates an obstacle from a religious standpoint. But I think there is access to abortion, so I don't know the details in terms of there are specific restrictions, but it's a very important point. I think your question you raise is something that should be part of one of our monthly meetings, Patricia. And so we should bring this up and have a discussion on that. Yesterday we have monthly meetings, and yesterday we had one on hip fractures, for instance, in the elderly. And it was really so engaging. What seemed to be initially somewhat of a boring topic, but it was extremely engaging, I think.
Oh, now I'll tell you, because hip situation, runs in my family on the male side, and one of my my brother actually had a hip surgery done with RoboDoc when it first came out. So hip surgery, and especially with the elderly, that's very important. With the elderly.
So
the topic ended up, catapulting into resources, medical management, what's available, rehabilitation, hospital stay, and what I had mentioned about pre-op testing, pre-op evaluation, and post-op care. There's a whole host of and even the aging population of Cape Verde. So just this one topic addresses a huge rainbow of issues, and that's why I think the meeting ended up being really very interesting and informative, because regardless of what your specialty is, and I'm not good at orthopedic at all, but there were so many of these other topics. Physical therapy was brought up. They have no place to rehabilitate people. It's all based on what people's resources have, their family resources.
On my bucket list.
So this one topic exploded in all of these other things that each of us can find some alliance with. So it was really interesting.
Well, a lot has come out of this. And one of the things, again, I had to backtrack, because I do get emotional when I start talking about these wonderful experiences. And, as you're moving forward with all the things that needs to happen in Cape Verde, and that folks like you are continuing to give back. That's just, again, so magnificent and so beautiful. Justina, I'm going to give you kind of last word. I'm going to let each one of them, we're going to wind it up in a second, but I want each one to have a last comment to make, and I hope that when we do air this, I want you to know that it will be live streamed, and anyone across the world can live stream it at that particular time when it comes on New Bedford Public Access. And I'm also going to have it on YouTube, and I will share the link with all of you at that time. But Justina, why don't you go ahead and say something to wrap up, and then I got one more announcement to make.
Sure. Well, it's been a delight to meet you all and to hear about your trip and about this initiative. I would love to hear a little bit more about, as Jeanne was mentioning, this is a way to give back. How can we as the community and the community across the US, people who may be tuning in, who want to support this effort, how can we help with your fundraiser? How can people learn more about that?
So you can go on our website, which is www.cvaphysicians.org, and you can sign up for the fundraiser, buy tickets for it. You can also donate directly on our website. I mean, that's one way in which the community can contribute. We also need to network further. We're a young organization, and I just learned about Justina today, and I'm going to reach out to you to be a part of that. And you mentioned Dr. Spencer, so maybe we need to reach out to Dr. Spencer. And the more I meet people, the more the network spreads. And so developing that network is the key towards becoming bigger, more engaged, and more effective overall.
Like I said, this is going to be on her bucket list. She's going to check off this on her bucket list to be part of this group, Justina. And she's a wonderful young lady. I'm out here supporting all these younger folks to do and be involved in things. So I'm just happy that she was able to join us today. And where is this fundraiser taking place?
It's taking place on July 9th at Caesarea Evora, at Caesarea Restaurant in Boston. And we also will be present on the Independence Festival in Providence, Rhode Island on July 10th. Yeah.
All right. Patricia, any last comments, words?
Yeah, so, like you, Jeannie, I get very emotional when I talk about what I'm able to contribute. I'm very, and this organization is, like I said, is quite unique, and it is because we're all Cape Verdeans, and having a group of Cape Verdean physicians just raises the level of intellect. It raises the level of innovation. It raises the level of curiosity, because we're all very highly educated, but we're all very compassionate about our homeland and the land of our ancestors. And because of that, there's so much that we can achieve. And so we need resources, we need money. We all ended up paying a lot of money to transport our equipment and to fund our trip. But we know that it was the first of many. And so as people can help us with donations, that would be greatly appreciated. But there's so much that we can do for the country, for our colleagues in Cape Verde, and for ourselves, because it's wonderful for us all to meet, each other and to really get to know each other. So it serves a lot of different purposes.
Okay, thank you. And Dr. Fernandes?
The only thing I would say is that to highlight the two words that Julio had mentioned, which is the networking, to help us to network, and don't forget that you yourselves can become members in many ways and help support, whether it's financial support or whether it's donating your time to help the cause. And I think there's nothing better than being at home, helping your people, and creating a stronger bond amongst each other. So I look forward myself to the next trip, and I hope we'll have many new faces.
Yeah.
Okay, and let me just give you, I didn't give you any background on me and how I started the making of the Cape Verdean. This came out of my father's book, which I edited and published, The Making of the Cape Verdean. It's a historical piece, and he talks all about Cape Verdeans when they first came to New Bedford, and from I think the early 1900s up until 1970. And he passed away, but he had given me the manuscript, and I was determined. I knew I had to get that book published. And so that's my contribution to this community and to Cape Verde, is that I'm always keeping the history going, letting people know what our people are doing, you know, preserving the history and culture. So that's what the making of the Cape Verdean is all about. And I'm so happy and so glad that you was able, all of you, to be a part of this today. And I thank you. But there's one last announcement I want to make. And I know, Julie, you talked about being a part of what's going on in Providence. But in New Bedford for the Cape Verdean Parade, we have Dr. Patricia Andrade, who's going to be our Grand Marshal this
Yay!
year.
Yeah.
So
I'm very excited about it. Yeah.
Absolutely. And it goes right by my house. So if anybody wants to come and sit on my porch, you know, to watch it. But I'll actually be in it too, because that's another thing. I'm one of the founders of the New Bedford Light. And that's an online news source that it's free. So you can access that and see what's going on in New Bedford. It's called the New Bedford Light. So, you know, join in on us, and you get to see some of the things. And they're going to be talking, and I'm sure Patricia, we're going to have a big photo of her on there as the Grand Marshal in the parade. So thank you so much, everybody. And I hope to see you at the fundraiser.
This is awesome.
Thanks, Jean.
Thank you.
Great work.
Thanks for the opportunity to talk about our group.
Absolutely. And when you're getting ready to do something again, I'd love to have you come back on and do a follow-up.
Okay,
I want everybody to know what you're doing out there.
great.
Okay.
Thank you.
And Istanbul, I know it's late out in Istanbul, so Rui Fernandes.
Have some coffee, some Turkish coffee, right?
Yeah, that would keep me up for days.
I can
Yes,
imagine.
yes.
Take
See
care,
you guys.
everyone.
See you
All
guys.
right,
Thank you so
everybody.
much.
All right,
Thank
Love
you.
you so much.
lot.
Thank you so much.
Bye-bye.
Appreciate it.
Bye.
Bye-bye.